for joining us today. As Ollie was just saying, this is the second edition of our men and mental health discussion that we've started. The remit of the discussion is really simple. The idea is to bring together a group of us and talk about men's mental health difficulties, emotional struggles, access maybe to mental health difficulties. And as a result of us talking about it here and sharing this more widely in the community, the aim and hope is that it gets other people in the community, wider community, to talk about this. And the more we talk about it, hopefully the less stigma attached, and hopefully it'll lead to some improvements around men getting support that they need. So the theme of today is around masculinity and mental health in a modern world. And before we start that, I just thought it'd be good to maybe have a introduction so that we all know each other a little bit, and anyone listening or watching this also familiar with you guys. So I'll start us off. My name is Madi Gomi. I'm a consultant psychologist at Solent NHS, and essentially have a passion for mental health, and particularly men's mental health. So maybe if we could go around and introduce ourselves a little bit, and yeah, just say a little bit about yourself, who you are, where you're from, and just anything you think would be helpful for us to know. And I'm going to go in order of my screen. So Nick, would you like to go first?
Yeah, sure. Hi everyone, my name's Nick Wilson. I'm an Army veteran, so 14 years. I got out 8 years ago. In the past 8 years, I've set up and created 2 successful businesses. The first one being a chauffeur company, which turned into a £250,000 business in year 2. Then I had a mental breakdown in year 3, had a suicide attempt and ended up in rehab with combat stress. And then the second business, that was 4 years ago last week. The past 4 years has been a journey of recovery for me, which my passion then turned to mental health as part of my recovery. I started a mental health consultancy 3 years ago, which is now a successful business in its own right, providing mental health training and consultancy. Yeah, I predominantly, I know Fiona Garth, she was the one that suggested I come along today because she's seen my work on LinkedIn. I ran a men's health online seminar last week, an all-day event, which went really well. Currently just editing the recordings for that actually. And predominantly I've got physical health problems, and hence the screen, because actually I'm laid up in a bed. So I didn't want you to see my bed, so I've got the screen there. Yeah, so now I'm a mental health speaker and ambassador really for especially around men's health, but also campaigning for the partners and family members. So yeah, it's like you, Marty, it's very much a passion of mine, and I've been diagnosed with complex PTSD, generalized anxiety disorder and depression, and I'm now studying a positive psychology fundamentals level 5 diploma.
Wonderful. Wonderful, thank you. It's great to have you here. I really like the background as well. It's great to have you here. Thank you for sharing. Okay, so moving on, next person I've got on my screen is Niall. Niall, would you like to introduce yourself?
Hi guys, so I'm Niall. So I work alongside Maddie. I work in the NHS in Talking Change, in kind of short-term services. So I work in the low intensity team in Talking Change. And like yourselves, you know, real kind of passion for mental health and a real kind of desire to know why seeing as many men within our service in particular, but you know, it's kind of a global phenomenon. So you know, I'm really happy to be involved in these discussions, trying to kind of break it down a little bit and seeing what we can do, you know, in the kind of breadth of all the experience that we have combined here.
Yeah, have you got something?
Wonderful, thank you, Niall. It's good to have you here again. Dan, you're next on our screen. Are you? Yeah, great.
Good afternoon. Yeah, hi. Got children here, so excuse them if they pop out. Apparently, it's the new normal. So thank you for having me this afternoon. My name's Dan Arnold. I am one of the co-founders of All Call Signs, which is an armed forces veterans mental health platform. Aside from that, I am a PTSD sufferer, have lived experience of mental health, and I spend a lot of my time now championing mental health within the armed forces and wider in society within men And it's really good to kind of be here and help kind of change those, change the dialogue around men's mental health, and hopefully empower other people to reach out and speak about their own mental health, because after all, it's okay to not be okay.
Wonderful. Great to have you here, Dan. Thank you.
Thank you, Maddie.
Matt, you're next on my screen.
Okay, my name's Matt. I'm another veteran. Okay, I'd served 24 years in the army. Started in the infantry. I ended up as an instructor, combat medical technician. I worked a lot teaching primary healthcare and a lot of pre-hospital emergency care. Again, I suffer from complex PTSD, and I was medically discharged in my last year of service. I now work for Positive Minds within Solent Mind as a veterans wellbeing advisor. Now, again, I also run a regimental mental health wellbeing page as well for my old battalion, also my old regiment. And yeah, obviously we see a lot of friends and colleagues who are suffering severely with mental health issues. And yeah, I think like everybody else here, we've got a real passion for addressing these problems.
Wonderful. Thanks, Matt. Great to have you. Great to have you here. Anthony, you're next on my screen, if you can hear me.
Yeah, hi guys. My name's Anthony Knight. I veteran. I served 28 years in the Navy as a warfare officer. Saw a lot of frontline operational service. I came out and started a second career in psychology, and so I now work with my own private practice as a therapist. But I'm here representing both Health Watch Portsmouth and also Forgotten Veterans.
Pleasure to have you here as always, Anthony. Thanks for being here. And it's great to see so many veterans involved in this group. I'm forever struck by what a great campaigning veterans in Portsmouth do around mental health, which is really, really wonderful to see. So it's good to have you guys here. Gareth, you're next on my screen.
Hi guys, yeah, thanks again for having me. So yeah, Gareth Spooner, I look after staff wellbeing at Portsmouth City Council. So obviously quite a large majority of our workforce are male, and one of the largest reasons for absence within the council is due to psychological reasons. So I'm looking to sort of see, like we sort of discussed today, if there's any more I can sort of promote to our staff to help manage and maintain mental health within our male staff, because I don't think they access the service as much as our females within the council. So hope we can maybe increase that as well.
Yeah, it's great to have you here, Gareth. It's a familiar story, isn't it? It's a recurring theme. Everyone you speak to, men are just often to be routinely underrepresented across health services, particularly mental health. Matthew, you're next on our councilman on my screen. If you could introduce yourself.
I'm Matthew Williamson. I'm the City Councillor responsible for health, wellbeing and social care. I've got lived experience of mental health issues from some years ago when I had a relationship breakdown, and more recently I worked for 3 years for the Roberts Centre as a holistic support worker, and quite a few of my clients, my male clients and my female clients, but first instance my male clients had quite serious mental health issues. So I've worked as a support worker for people with those issues as well, including accessing some of the services that are here today.
Wonderful. It's a pleasure to have you here. Your campaign for mental health is really appreciated. So it's great to have you here with us. Thank you. Next on my screen is Stephen.
Hi, I'm a strategic lead for personalised care, which is a new post within Solent through redeployment. Probably worked for Solent now, getting on for 17, 18 years. So behaviour change specialist, coming from a background of stop smoking, weight management, So really interested in human behaviour change and mental health, and also I guess men's lives, our roles, and how it's really forever, it's changing, and it's like kind of brings up questions, some strong questions, which affects mental health for sure. Yeah.
Great. It's good to have you, Stephen. Thank you for joining us. Ollie, you briefly introduced yourself at the beginning, but maybe if you can say a little bit as well about yourself.
Yeah, so I work as the press and communications manager at Solent. So I'm kind of representing the comms team and helping Fiona to help facilitate these calls moving forward. But I think it's really important that we get together and freely sort of talk about these issues. And I know that from the last call, I think it was a very productive session. So I'm just really interested to see how today develops and how we can sort of keep this going, sort of moving forward, and what perhaps we can get out of it as well.
Wonderful. So thank you all once again for making the time and for being here today. So as I mentioned before, the theme of our discussion today is around masculinity and mental health, particularly in the modern world. And if I can maybe just take a few minutes to just introduce this topic, and then really interested to get your thoughts and views on it. So one of the questions I sometimes ask myself is if men are at a risk of identity crisis in modern life. Do we struggle maybe to find our place a little bit in this world? If you think about it, over the last century, through the Industrial Revolution and the sort of social and cultural reforms from sort of 1960s onwards, the old traditional gender roles of men as breadwinners and women as homemakers, no longer applies. We aren't accustomed to having big families with lots of children anymore. Thank goodness women can now have successful careers and more social freedoms. They don't have to be stuck at home raising big families and needing men to support them. So this evolutionary archetype, if you like, of men as provider, protector, has perhaps been changing a little bit for some time. So I suppose the question that comes up for me a little bit is, if we're not necessarily the provider, protector, then who are we? Women in many subjects now outnumber and outperform men in university and colleges. In terms of salary, there's still inequality. There's still some progress to be made, but men are more likely to be homeless. Men are more likely to be in prison. Men are more likely to die from suicide. Men have a lower life expectancy. We also know deprivation is closely linked with poor health, and there's research to show that unemployed men are more likely than women to smoke and abuse alcohol and drugs, which we know cause complicated health problems. So what's behind these very depressive stats, if you think about it? Is it because we've struggled with adapting to changes in society and in a way maybe reinvent ourselves in the modern world? Are we ill-equipped to deal with the challenges that comes with modern world and the emotional pain that comes with it? I sometimes think that maybe we deal with our issues as men, particularly through violence, maybe through substance misuse, through unhelpful competitiveness, bullying sometimes, because maybe we aren't better prepared to fit in the outside world. We aren't taught self-care or how to be sensitive and compassionate, things like that. I don't know about you, but when I was growing up, sometimes we're seen as weak or uncool or unmanly somehow, and what's worse is that services are not set up adequately for men. So just as an example, I think about 30 to 40% of survivors of domestic abuse are men. Yet there are no male-specific domestic violence services. And there's no, as far as I'm aware, comprehensive national agenda to address some of those stats that I shared earlier. So I suppose the question, or a couple of questions I want to put to you to get us kind of really talking about this is, do you feel there is a crisis of identity for men? And if so, does that have any impact on our mental health well-being?
Well, I can jump in. Yeah, I think you're completely right, Maddie. Sorry, it always happens, doesn't it, Nick? Yeah, no, you're completely right. I feel we're almost conditioned by society these days as men, that makes things difficult and compounds issues as adults, and I'll elaborate. So as children, especially with my upbringing, like if you were to cry, for instance, you normally get a cuff around the back of the head, stop crying, or I'll give you something to cry about. Then children, playground can be quite difficult. If you're showing emotion, again, like you touched on, Maddie, it's defined as weakness, or you're not this kind of atypical masculine guy because you're showing weakness. And I think that then builds in people's lifetimes. And then as adults, men specifically find it more difficult to open up and have those conversations. Colleagues here that work within the mental health space will know that there are kind of two types of men that we face: those that are coiled like a spring, who can't wait to fire it all out and tell you everything, or those guys that will be like, I'm all right. Well, are you okay? Like, come on, let's unpack that. Let's talk. Whereas women on the flip side, I talk about it a lot in my public speaking. You're hard pressed to not get women to talk about their issues, whether it's to the girls, to their friends, to their hairdressers. They're offload constantly, whereas we more carry it, and that's what can become a burden and can become too much for some men. I mean, we're still looking at statistics that you're 3 times more likely to die of suicide as a man than you are as a woman, with the peak range being between 45 and 50. And I think we owe it as kind of men together to empower other men to talk and open up about emotions, because that's the only way you're ever going to deal with things.
Yeah, I think you're absolutely right, Maddie and Dan. You know, I agree with you, Maddie, that the loss of identity. It's interesting you mentioned about self-care, because I developed what I call 3 self strategy, crap title, but I couldn't think of anything else, which is self-awareness, self-care, and self-help. And if you think of those 3 areas, if we can, and that's basically what I've been trying to do, is to encourage people to look at those 3 areas. And I do that through inspiring people to want to know more, to gain the education. So if we inspire people, we provide the education, we then empower them to be able to better manage their own mental well-being. And whilst times have been changing, and that culture that you mentioned, whilst that has all been changing, there hasn't been anything available for men, life skill wise, even from schools, which provides them and empowers the boy, the male, you know, to be able to identify with who they are and where they fit. So times are changing, women are changing, but men aren't. And they're not being empowered with the ability to identify with, you know, what their purpose, meaning, identity is. And I think the stats for within depression, 75% of the reasons behind the depression is due to a lack of purpose, meaning, and identity.
Absolutely.
Yeah, I think when you look at that as well, so yeah, we're talking today about masculinity. In today's society, masculinity is seen as a negative attribute. It's masculinity is now a negative word. When we look at people throwing words around and phrases like patriarchy. So on one side, the male psyche is you're beaten down because you're male. You seem to be too masculine, and masculinity is a bad thing. But then on the other side, you're told, no, you need to behave like a man as well. So there's these 2 different messages coming.
Man up.
Yeah, so it's man up. You need to start acting like a man. So when it comes to relationships as well, so you could be in a relationship where where masculinity is a bad thing, but now you're expected to act in a masculine way within a relationship. And these are very sort of confusing signals we're sending out as well. We take it back to the military, where we're now seeing more and more women going into frontline roles. Okay, now in the military, it is the nature of the job is very violent. It is very violent. You're expected to do great violence against other people, but we're still looking down that men don't hit women. So men don't hit women, and you know, there's still this massive stigma attached to domestic violence against men. So there's this stigma where it's seen as acceptable to hit men, and in relationships for men to be beaten. And you know, a lot of people say, look, domestic violence doesn't happen to men. But so we've got these two different opposing views which are being pushed onto men constantly.
Yeah. Whereas actually the stats are actually 30 to 40% in most of the stats you see, survivors of domestic violence are actually men. Not that it doesn't happen to women, of course it doesn't, that's a major problem,
exactly.
but also it happens to men.
So yeah, I mean, when we look at, we sort of put, now when we go into this frontline sort of environment where, you know, we expect parity, but we're expecting parity, but we're not expecting parity in a way. It's a very confusing message in today's society. And yeah, so I think that could feed into it quite heavily.
Yeah, it's a real tension, isn't it? That tension that you just touched on, Matt, that between, you know, are you supposed to be a man's man, you know, are you supposed to be more kind of a modern man? That constant tension and confusing messages, as you said, I sometimes wonder goes at the very heart of the mental health difficulties that we have. You know, if you think about that sort of evolutionary makeup of us being the protector and the provider, which obviously outdated now, but sort of intrinsically maybe within a lot of us, how does that affect our ability to then seek help? You know, if you're the provider, if you're the protector, is there a conflict then for you to come forward and actually ask for help and show vulnerability and needing to be supported, be the one that's be supported and rescued in some way? What do others on the group think?
One of the interesting, and this certainly came out from my support worker days, was one of the interesting things is how much that kind of that Matt's alluded to is and Dan as well, that things like weakness. So if you know there's a weakness if you talk about your feelings or you access support or whatever it is about how that comes down from the previous generation. And it almost becomes a self-fulfilling prophecy. So you think, oh, well, the next generation will get it kind of thing. But remember that everyone is influenced by their generation above. So, and that's often something that just comes down in terms of, well, this generation has the generation above, but the generation above was influenced by their generation above. So it's almost like, and there's the expectation, man, as Matt said, man up. You know, you should be a man. You should do things in this way, and almost as well that when people are thinking about, well, should I act in a different kind of way? They've still got within their families and their friends, maybe older friends or relatives, who are then saying to them, no, don't listen to that. It's all modern stuff. You still need to act in this way. And so it just becomes so how you break that cycle of getting from this a culture which may be outdated, but it's not outdated, it's always there because it just feeds itself through, and understanding that rather than just expecting everyone to be of a situation whereby they haven't had access to that kind of attitude. And of course many people, many men who are find themselves in those situations have been abused themselves, and I think that's a real when they were children, and that's something again that you find so many people who find it almost impossible to talk about until they become much older.
Yes, I'd like to pick up on that, on what you just said. I mean, I'm not sure I have answers, but I can provide observations. I'm not seeing coiled or people out there at the moment, nor am I seeing people who are trying to front it out. What I am seeing is a level of frustration and despair, and in particularly two areas with men coming from both work on the voluntary service and private practice, and those two areas are either with complex PTSD. When you actually start to probe and investigate that, it always seems to start in an early childhood state of either sexual or physical abuse with men. And whilst men, I find, will talk about the things later on in life, actually dealing with those early childhood memories is where it has to start. The second thing which I'm also seeing is frustration, which is a product of our environment at the moment, particularly with men who are coming out of marital breakdown, relationship breakup, where there are children involved. And there's a growing level of frustration as a result of CSA and of the court actions, a number are under court restrictions, and they are really struggling to cope with the monies which they're handing over, but having no voice, be able to have any input into a child's upbringing, how that money is spent. And of course, they are breaking these court orders, which are getting themselves into further trouble. And that's just increasing their level of mental instability at the moment.
Really, really good points, Anthony. I think that is so crucial, isn't it? There's some of the things you just touched on there around, because it goes into issues around housing, it goes issues around finance, but crucially, it goes to the very unit of family. So being separated from the person you're in a relationship with, but crucially, limited access to your children. I mean, those are things goes to the heart of any human being. And you're absolutely right. And I think and I'd be really interested to see what you guys think, as well as early abuse and early experiences. A lot of this, I wonder, is because we're not taught ways to manage our emotions, manage our relationships, manage communications, manage conflict. Maybe we deal with these issues through unhelpful strategies that we just pick up along the way or learn from others, but not ways to really solve these problems, which then lead to very serious societal problems that you've highlighted. Matt, I think you had your hand, you wanted to speak.
So just come back in there on two points really. Is what Anthony said there was absolutely right. I mean, from my personal experience, I know many others who have been in the military where it's like a badge of honor where you leave. The pressures within the military on relationships is huge. And again, when we talk about masculinity and when we talk about parity between sexes as well, it's is very discriminatory for obviously one side of the family. It always seems to be that way. And yeah, it's when we talk about discrimination, it tends to be against the father in the family when these relationships break down. But the other one as well, coming back to what you said, Maddie, about when we lose that ability of being the breadwinner as well, which is something I think psychologically the male is still getting round to. Not being the breadwinner within the family unit as well, not being the breadwinner, feeds directly into Jordan's theory, perceived burdensomeness. That becoming a burden on your family because you're not providing. As we know, that is one of the two major factors which feed into suicidal ideation. And I think you've hit the nail on the head there. That perceived becoming a burden because you're not the breadwinner and relying on other people is that's 50% of suicidal ideation according to Jordan's theory.
I was just going to pick up on points you said, Maddie, as well about sort of not being built into men to sort of seek support or know how to seek support early. I think from my experience in speaking to friends, colleagues, it's probably more at a crisis point that men will actually reach out for some support or will actually discuss what's been going on. So I think early intervention is a massive key. I think it's built into what everyone sort of said there. It's part of our DNA almost to try and man up, as people have said, to try and figure it out ourselves, or we'll look at some unhealthy behaviours to try and hide it over a period of time until it gets to that point where something else happens or actually we can't deal with that anymore.
Yeah, really, really good point.
Sorry.
Yeah, Stephen, I think that was cool.
Yeah, I think men are trapped. I think they're completely, in a way, trapped. Fair enough, women's identity and role have changed, and so it should have. I think men have been either left behind or kind of, in a way, out of it. I think men want to change. They know it's. I think there's a sense men know it's not okay as it is, and there needs to be change. But there's, like you said, there's no services. There's not even, and it's right across all ages from the very beginning, from childhood. I think every male, boy, man experiences this, and there's just no provision. So it's wanted, but it's not there. And I think society as a whole find it difficult and uncomfortable to accommodate the change that men want and men desire. So I feel they're really caught in this kind of limbo, no man's land, and it's trying to find a way or a process to get out of that, to move it on. And I think, you know, these forums are I think it's just amazing. When I first saw it, it's a great initiative to kind of start the ball rolling and start pushing, and, you know, kind of make it higher on every agenda. And I think there has to be, I think men have been somewhat shot down in some respect, as it's no disrespect to women, but when their roles changed, it's almost like we were kind of kicked, as in it's our fault, and we have burdened, I think, burdened some blame on that. But now is the time to kind of change that landscape, change that perspective, and have a different viewpoint on it to move it on and progress it, because it needs it. It needs it.
Yeah, I mean, well, you know, the sort of the heart of the evolutionary theory is that it's not so much the survivors of the fittest, it's actually those who adapt the quickest to change.
Yeah.
And the reality, I think, is we just haven't adapted. The world has changed around us over the last 40, 50 years, and at a very speedy pace more recently. And we just haven't adapted. We're kind of still lost in that kind of confused state of who we really are in this new world and how we can contribute effectively.
I think society as a whole, culture as a whole, doesn't know what to do with us. Do you know? It's like being caught. It's a really difficult, uncomfortable place to be. Because it's like we want it, but it's like where I think we know more, but there's still not, if you like, the avenues or the opportunities.
Yeah.
I'd like to build on what you said there about, and what you said as well, Matthew, about the, you know, things being passed down. I think when you do look at the changes that have happened for women, especially in the last kind of 10 years or so, the kind of real strength of feminism is that they're kind of taking things that have not been offered to them before, you know, like power and responsibility. And it's adding to the strengths that we already seem to be in the kind of female character, with like compassion, you know, emotional intelligence and things like that. But when you look at the kind of strengths of a male character, a lot of the time it's the omission of these things, which is seen as being the strength of men. So the omission of kind of showing emotion and being that kind of stoic, kind of brick wall person. So when you look at the fact that, you know, the female role is expanding massively into, you know, higher paying and kind of more powerful roles, where the kind of expansion of men in the opposite direction is to be more kind of open and more kind of you know, discussing things more. What you're looking at is you're going against things that have maybe been passed down to you by your parents, by your grandparents, and it's about trying to break that mold. You know, being the generation that decide, actually, you know, as we're trying to do here, it's not weak to speak, it takes balls to talk. All of these, you know, really important messages we're trying to show is that, you know, there is more to strength than being that kind of brick wall person. And actually, that kind of emotional expression is something which isn't easy to do, but it is the kind of necessary change we need to make, because we can no longer be, you know, in charge of everything. We can no longer be that support, because roles are so fluid, and there is so much change. And like you say, we haven't adapted for at least 50 years, if not 100, in terms of what that male role is. And so much has changed, even the last 5 years with feminism.
Can I just ask, do you think that society finds it difficult and uncomfortable to accommodate the change that we want?
Can you say a bit more about that, Stephen? What do you? It's an interesting point. What do you mean by that?
It's almost like the whole of society needs to be more open and, if you like, upskilled. that they haven't got the tools or the abilities, as it were, to be able to accommodate the change men want. I think we want it. I find the rest of society, as it were, it's difficult to actually open it up a bit more. But I kind of find society almost resists because they find it difficult to accommodate this massive change that we want. And it's like a hot potato. What do we do with it?
Yeah, I mean, just picking up on your point there, I mean, one of the things I often think about is if, as we're all saying, if the crisis of identity around masculinity is at the very least feeding into, maybe not the only, but one of the issues around mental health difficulties, around challenges of seeking help, fitting in, then do we have a picture, do we have a blueprint of a positive male identity that could exist in this world, that could fit in this world? Is there an alternative, or is that where we need to start thinking about what does an alternative even look like?
I think it's not knowing, going back to knowing who you are as an individual. You know, we can't change society as much. We can campaign and pass the messages out there and things like that, but it's trying to instill it into men that actually identify who you are as an individual, what your values and beliefs are, why you've got the values that you've got, why you see the world in the way that you do. And, you know, 75% of the decisions that we make in life are based on our past, are based on traumas from growing up and, you know, up until that day. And I've listened to a lot of what people have said, and I agree with that, everything that people have said. And, you know, transition is a big problem because we don't know how to deal with it, whether that's transition of a veteran into society, whether that's the transition from being married into being separated, whether that's, you know, any kind of transition from being furloughed back into work, even from COVID back into a new way of life. And because you don't know how to deal with that, and this taking into consideration, thinking about everything that everyone has said, it all seems to come back down to we've not been given the tools, techniques and coping strategies. We've not been given the opportunity to be able to identify with who we are. You know, society's going to think and do whatever society's going to do. You know, back in the day, society didn't think that women should be working, you know, but they changed it. They changed the narrative. So then it's down to us to change the narrative. And to hell with society, they can think whatever they want. But if you as an individual, and we're talking about relationships and they want the masculinity or the rest of it, but if you're an individual who knows who you are, who knows what you want, and is comfortable within yourself, and you've got the tools and techniques to be able to manage shit that happens when it happens, and you've got the ability to ask for help, you know, and you've gone through that process of acceptance that, yeah, I'm happy to ask for help should I need it, then that within itself shows strength, you know, shows strength of character, shows the vulnerability. You know, Brené Brown speaks a lot about vulnerability and the power of strength in being a vulnerable person and actually demonstrating your vulnerability. But someone said it, I can't remember who it was. Where do males, regardless of age, where do you go for support? Because if you go to your GP, if you're not demonstrating poor mental health, you're not going to get the support. Yeah. So they're not going to refer you to anywhere. So where do you go? And then you take it back to schools, within the schools. Kids, you know, boys aren't being taught life skills. You know, generations, I think, are changing. You've got the millennials and, oh God, was it the Gen Zs who are coming through now? They are a lot more in tune with their emotional well-being. So I think someone said about not culture, about generation, feeding generation, and then, but I think that's having less of a grip because you've got more freedom nowadays to be the people you want to be. You got teenagers who are openly gay at the age of 13, for Christ's sake. but you've got also a masculinity. I think that there's growing percentages of young boys having eating disorders and bulimia problems. Because,
massive issue.
again, they don't know who they should be, and they've got all these emotions and they don't know how to manage these emotions. So it's right across the age, range, and by simply helping people to identify who they are as an individual, what their values are, their mindsets, their purpose, all these kind of tools, all these kinds of things will then be able to help them. But then the largest point is, where do you go to be able to gain that?
Yes, absolutely. Yeah. Absolutely. And I think your point there about eating disorder is a really important one, because it's not just, as you said, eating disorder, but also body dysmorphia is a major issue, especially around excessive exercise, excessive bodybuilding, which is, if you think about it, is just a very obvious another outlet, another way of trying to identify, I think, almost fit into this world, but obviously going overboard and coming at with unintended consequences of your well-being.
I think, sorry about that, but I think we could talk about that with body dysmorphia and how an individual perception, and how the next generation, how these guys are growing up. They've got no positive role models. I mean, society is changing at such a pace. I mean, even look over the last couple of months, it's people are, and the way social media work, people are being attacked. I mean, you look at how attitudes have changed even in the past few years. Yorkie bars. A Yorkie bar used to have a little wrapper on it that said "not for girls" on it. You tried putting that out, you would get absolutely attacked. You'll be on social media, you would be an uproar. There'll be people camped outside your door, waving banners at you. They using the term, saying, "Oh, stop being a girl." Okay, that would be absolute uproar. So these are massive no-nos in today's society. So using those examples, that's a massive, can't do that. You'll be attacked for saying words like that and phrases like that. Whereas these masculine ideals, masculine imagery, it's becoming that's a negative. Displaying any sort of masculinity is now seen as a negative. Which is
very interesting. I find that there is a complete lack of role model out in today's society. Absolutely. And I borrow a technique from EMDR because we try to put techniques in place, because we know that there are going to be fallbacks and setbacks. So we want to surround those people who are going to be vulnerable with ideals. And when I do ask them, who is going to be in your camp, who is going to provide the wisdom, the nurture, and the protection, they don't relate to anybody in our current society. In fact, they pick up from characters from non-fiction and fiction, characters of the past, and even animals. They identify with nobody in our current society, and that's what I'm finding.
That's such a good point, I think, Anthony. I think that's where I often, when I think about it, I think that's where we're at. We haven't really defined what an alternative, if you like, a workable male identity in this society would look like. And I think that comes down to exactly what you said. We don't have good enough role models out there that really kind of lead the way, that kind of maintain some of those evolutionary, intrinsic part of who we are. So it doesn't try to kind of deflect from that, so that creates the attention, but also find a way to fit in this world, find a way to be in this world and deal with challenges in a way that's productive, in a way that doesn't cause loads of other unintended problems, unintended consequences. And I think that is a really interesting conversation to have. What does that look like? And how do we then foster or identify those qualities and promote that more widely?
I think society is changing though, isn't it, Maddie? Like, language is changing, and now we've just got to wait for that kind of behavioural change. It's the turning of the QE2. You don't have to look too far for role models within the mental health space. Someone like Tyson Fury, who would typicalize masculinity, he's like the heavyweight champion of the world, and he stood up and said, you know what, I suffer, and this is what I'm doing. I'm not saying that everything's been perfect, but how many of these 10 tiles in front of us could say that? Rio Ferdinand, there's a lot of good people out there in society that are actually leading the way by standing up and saying, right, you may know me for this, but this has happened to me and this is how I'm dealing with it, and really using their voice for positive. Likewise, within society, there's a lot of like football groups, men's sheds, joe.co. And on the tools, really reaching into those heavy populated male societies and changing the language on mental health. And a lot of people on this call have rightly said that society isn't kind of turning, but there's 10 tiles here. We all have the own ability in ourselves. If we change the narrative and change the language and start positively speaking to people, that's how change advocated, and that's how it's brought around. So each individual male has a responsibility to themselves. Instead of asking your mate, are you all right, and getting fobbed off with, yeah, I'm all right. Well, come on, mate, you haven't really been yourselves. And we almost, as men, have to learn how to listen. A lot of men aren't great listeners. We listen to hear, we listen to answer, we don't listen to hear. And by changing our abilities to be able to listen to people and really be in tune, like, women are really great at it. They'll pick people up, they'll empower women. Like, we should be doing the same as men. We should really be looking out for each other, spotting those warning signs and changing language and narrative that, do you know what, you can talk about it. Do you know what, I've had a really bad week this week. Work's really mounting up on me, but we just don't. But it, like, those small steps from small acorns grow mighty oaks. And that's where I think we're on the cusp of.
Yeah, really, really good point, Dan. I think I would also add to that, I completely agree with everything you said. You guys, you veterans, particularly amongst our group here, but also more widely in the city and more widely in the country, I think you guys play such a crucial point in this, because when you come and talk about the importance of mental health and break down some of that barriers, it has an extra power coming from you guys. And I think exactly what you said, that could really kind of almost break down some of those barriers and say, if a veteran coming back from war and talking about their experiences in this way, why can't I? And that power, I think, is something that we can really, really push through and have much more positive ripple effects. Nick, I think you had your hand up. You're on mute. Yeah.
I was starting clapping along with people. I thought it was rather than me opening my tracks. I don't know when to shut it. So it's just easy if I react and clap to people when I agree.
There's an agreement.
Yeah, and then mute myself, because otherwise you'll never get me off the bloody thing. But yeah, I totally agree with what Dan was saying there, and we do have the ability in us, and it is changing. I'm seeing it. I run a local men's support group here, and I was gobsmacked at the amount of reactions that I got. You know, I live in Towcester, which is a small town just outside Silverstone, Milton Keynes way, right? Really small town, and yet we've gone from having 2 guys who came forward to suddenly I'm getting 20 to 30 messages within a matter of 2 weeks, and obviously we've literally only just started to meet up physically, you know, one of the posts reached over 22,000 people, and I didn't promote it or anything like that. People were just sharing it around. It was guys reaching out. So it is changing, but they are looking for people. They do need the guidance, and then they need the empowerment, you know, and giving the direction and the guidance, and how to move forward. And they are a bit lost.
I think something we hear a lot is what you just touched on there, that you might start with one person, and then when suddenly the word gets out, you know, people are talking about this, it suddenly blows up. I remember I watched a video recently about an ex-service personnel who suffered from PTSD, that he said that obviously services like ourselves need to have that confidentiality, you need to have that safe space, but equally the fact that it's very confidential means that you can't see that other people around you are going through it, because they're not going to be talking about it. And it's not until you take that really hard, you know, first step to put yourself in one of those groups and you realize, you know, there's thousands and thousands of people just in this area who are going through this, that you suddenly actually think, you know, this is something I can do. And it's going back to what you were saying, Dan, that we need to take individual responsibility for doing this. You know, there are more and more high profile people coming out and saying, you know, this is a thing. I think it has a lot more value when it's coming from, you know, your dad, your brother, your mates, or those people that you sit with at work all the time. And there really is that need for us to be taking those steps, because as soon as you offer something. You know, we've seen it here in Portsmouth with, you know, various kind of things that are springing up, and obviously the amount of, as you said, the amount of towers we have here, is that the need is really there, and people are so engaging with it once they're made aware of it, and then it's okay to speak. It's just that first barrier.
And yeah, I think again what Dan was saying there, it doesn't need to be these like, you know, massive stars who come forward. Sometimes it's your peers, it's peer led. So within my old unit, it's when the RSM or, you know, the Regimental Sergeant Major, who, you know, the top soldier in the battalion, he steps up there and says, look, I've had a problem with my mental health. Okay, that's when other guys start, you know, stepping forward. When it's somebody who is closer to you, who you respect, and you see it as a very strong individual, then stands up, puts his hand up and says, look, I'm having this issue, right? I'm having this issue as well. Actually encourages others who are suffering in silence to come forward. So it is more a near peer group as well, rather than having to rely on, sort of footballers and sort of celebrity as well. It's people who you can actually relate to as well. But with that as well, and look at how people present. Now, I was just thinking about it as we go through. So working, I think, Dan, you were an RCMT as well, weren't you? So Dan was another Army medic. And what I've seen from experience was when somebody comes forward and yeah, they've got a mental health issue and they want to talk to somebody, they'd come and see their medic, but they wouldn't come and say, look, I've got a problem with my mental health. They would come forward with a normal primary healthcare issue. These people, they would present, I've hurt my ankle, I've got a headache. They would present with a physical condition to say, look, right. And once they get in there to speak to that medic or somebody with that physical condition, which has got them through the door, and then they sit down and then they start to lay their problems out. And I think we probably need to look at how we're going to let people come forward and present to us and actually start to have that conversation. I know, as I said, as a medic, when I was working with primary healthcare, people would come forward and open up using that as a way of getting their feet through the door. And I think, especially with the current lockdown situation, with how we're having these medical, how we talk in the NHS. So in the NHS, how we approach primary healthcare, how we now deal with, if we're having an email consultation, so somebody wants an appointment with a doctor and he's going to open up about his mental health problem, him presenting with a primary healthcare problem via an email consultation isn't going to have that same effect. So are we sort of working into this? And can this be used as some sort of gateway to allow people to open up with mental health issues?
Thanks.
I wanted just to pick up on two things. I'm not sure you all know how Forgotten Veterans work, but we're in a unique position in order to be able to offer respite and also a retreat. We normally do that on a monthly basis when we don't have the problems of COVID. But now that we are opened up, we do run crisis camps, and we had a crisis camp last week, and we're straight into another one this week. 3 cases last week and 2 cases this week. What I would say about them, in all 5 cases, it wasn't the guy that came forward. It was the mother, it was the parent, it was the grandmother, it was the wife who had pushed them literally out the door. Go and get help, or you don't come back. So that's something which we really got to focus on. They're not putting their hands up and stepping forward, but when they do, they are seeing the benefit. And just to back that up is that if they reach out for help, we absolutely have to put something in place to make a first step and change for them, or they won't come back.
Yeah.
And that's where, if we're going to make changes for people, we really have to focus on what that change is going to be. Because once you've hooked them in, then they're more likely to come back. And that's, I think, for us all, those 2 issues is A, how do we get them to put their hand up? And B, how do we make that first change for them that they will come back?
It's hard enough, isn't it?
Don't you think that's where, sorry, Mardy, don't you think that's where, as you say, well, the biggest problem is because there's, almost, I don't know if disconnect is the right word, you know, between to actually get people through the door, because it's not easy, you know. I mean, I know I'm only one case, but I've struggled to get help, and even when I did ask for help, it's taken me ages to get help. And now that unfortunately COVID has happened, you know, the past is the past. It doesn't ultimately matter about the past. It's been and gone. I can't change it. But trying to get support now, there's such a backlog now that even if we did get someone to reach out, there's going to be such a waiting time before they will get someone will come and speak to them, or they'll get that referral or whatever, that, you know, they might just give up by the time it comes round to it, because the waiting time is so long. You know, I've been waiting over 4.5 months for my social care to kick back in again. And you know, the waiting times, I know it's going to be postcode lottery around the UK, and obviously you're I'm the visitor because I'm not even down south, but so I don't know what it is like down there. But how, Anthony, how are we going to do that? How are we actually, what is available that we're going to get them as quickly as possible, so you don't have that massive time lag where they're then going to bugger off and shut down again?
Well, certainly we're working on an individual basis at the moment. We do have to go out and get them. You know, yesterday we drove over, I don't know, a round trip of over 600 miles up to Manchester to bring a guy down.
Yeah.
And it literally is almost a case of going and kidnapping them with, you know, with their consent, as it were. Because when you do get them, and, you know, we are in a unique position to be able to offer respite, and not every, you know, facility is able to do that. But certainly in bringing them back down to Cumberland Fort, it is an eye-opener for them, because suddenly they are safeguarded with 5, 6, 7 veterans around them who come in and voluntarily support them. And it is reaffirming that there are good things, and that there is help, and that there is care, you know, available to them. And sometimes those smallest of things is what makes the change.
Well, that's good for veterans, and you're doing that. But Mardy, what's available when you're not a veteran?
So, I mean, you know, there are certainly services in Portsmouth, I think, where are better off, perhaps in some of the other parts of the country. It varies significantly, as you said, you know, from one area to the other. Even here in Hampshire, you know, it varies. In across the south, it varies. And also it varies on the terms of the difficulty that you have. So some difficulties, like let's say for autism, for example, there are lack of services, specialist services available. So it comes down also to the particular presentation that you have. But I think above all of those, what we're all saying is that it's so important. It's hard enough to seek help. It's difficult enough to do that. So that when that does happen, it's so crucial for that help to be accessible and speedy and effective as soon as it comes in, because otherwise there's a real danger of that further loss in trust. But that's in conflict with limited resources and, you know, the strain that NHS services and social care is under nationally, you know, and we're in Portsmouth probably no exception to other places in the country. So there are significant challenges, but I think what I'm sort of taking, and tell me if this is a sort of if you would add to this, but what I'm sort of concluding from our conversation is that there is definitely a crisis, or there's likely a crisis of identity for men, which does potentially feed into our mental health difficulty, has been going on for some time, and we've been slow to the mark to adapt. But at the same time, coming back to what Dan is saying, there are signs, positive signs of things shifting. So men, you know, both celebrities, but also locally, sort of community leaders really stepping up, really kind of putting themselves forward and trying to overcome that stigma. And that actually there's something really valuable there, because I think as well as it being important to have services available and accessible as early as possible, there's also something about tailoring those services, particularly for the needs of men, making those services as a custom and tailor-made, so that it's best fit for purpose. And there's a real challenge, I think, there about how we design services going forward. But certainly, if we talk about it more, I mean, I was having a conversation with my my barber a few months ago, and he was saying that in his experience, a lot of men come and talk about their difficulty. They relax. There's very little stigma, and that's actually an avenue where the person opens up. You know, in pubs, in areas that I think we don't expect, that's when the issues come up. So if we could find a way of utilizing those avenues as much as possible, then maybe we've got an opportunity to really start making a difference and hopefully overcome some of the barriers.
I'd just
There
like
is a
to.
network of barbers that are starting to, sorry buddy, there's a network of barbers who are starting to get mental health training and mental health awareness training. Some of them even getting MHFA training, which is a whole nother subject, MHFA as a course, but it's better than nothing. So yeah, that would be great. But wouldn't it be better if the government would inject more than £2 billion, which was pre-COVID, into actually being able to specifically provide the preventative type stuff, to be able to empower individual males to be able to identify their own identity, and yet the government haven't said anything about money, have they? And in investing in mental health.
I see. I've got. I'd just like to step in there. Is I see two issues. The first one I'd like to bring up is down in Portsmouth at the moment. I think we've got some really. We're not there yet, but in Portsmouth, what we've got coming up at the moment is we've got some absolutely fantastic ideas and projects going on in Portsmouth. Okay, and I'm going to fire this back out to a lot of the guys who are sitting here. Obviously, we're now up and running Positive Minds. We deal with lots of non-veterans, and it is, or the only way I can explain it is we do. It's like a mental health sick parade. It is a low-level mental health. It's primary healthcare for mental health. Okay, and we're getting there off the ground, and it's available, and it does what it does. Portsmouth itself, so we've got places like just down the road from Dan, so we've got All Pool Signs there, which is now nationally recognised with the work they're doing, especially over social media. Fantastic work, which is a beacon for helping the veterans community. That area in Southsea and Portsmouth is outstanding. You've got the Lord John Russell pub. We've got Tonic. We've got all of these different things in and around Portsmouth, which we're doing absolutely amazing work for mental health and feeding into men's mental health as well. So Portsmouth really is a beacon for the rest of the country. And there's an example of that, especially turning around to Anthony as well. With the veterans community, as you said earlier, it's a postcode lottery out there. And I'll just get back onto this in a second, but it's a postcode lottery out there. What we have with the amount of veterans we have in the Portsmouth area, is our provision for veterans mental health, I would say, is better than anywhere else I've seen. I have soldiers from my regiment back in East Anglia, and on the regimental page that I manage, again over social media, we have people who are they put a cry for help, and they're on the bones of their arse, and they're just calling out for help with mental health. And we've gone up before and organised to get people down to Portsmouth to get them into Voss, because they've walked into there and said, I've not seen anything like this anywhere else in the country. And then from that, we've introduced them to people like Dan, we've introduced them to forgotten veterans. And I've had, I think over the last, just before we went into lockdown, 2 of my soldiers from my regiment who were in a very bad state, I've been down to forgotten veterans in my role as a regimental peer supporter, where I've gone in there and seen forgotten veterans help turn people around. And that is down to the provision we've got down in Portsmouth being recognised on a national level. But when we talk about funding, coming from the military background, we understand that defence medical services covers the whole of the country. So a policy in the RAF in Scotland is the exact same policy as the Royal Navy down in Pompey. And it is the same equipment, the same everything. when we talk about the NHS, there are hundreds of different NHS trusts, all having a different piece of the pie, all got their own procurement, and all trying to take a piece of that money, and then they're translating how they're going to spend that money differently, which means that between Solent NHS and Hampshire NHS and all of these different NHS trusts will do things differently, and they will put that money invested in different ways. So I think nationally, we need to have that joined up conversation about how we address mental health, because it's not something which is down to trust level. We need to have that sort of conversation at a national level.
Good point. Matthew, I think you had a point. Did you want us to raise about the Connect 5 training?
It was just to say about the Connect 5 training that the council does, which is mental health training, if you haven't come across it, which is available to organisations and businesses, people who work for businesses in the city, and it is a free training course. It's 3 sessions, and it's really good. So one of the ones that I did, because I actually did it when I was working for the Roberts Centre as a support worker. That's how I ended up doing it. And one of them was from Drifting South, the bar there, and they actually got all their staff to do it. So it's a really positive thing. So if there was a bunch of barbers who wanted to get together and do it together, then that would be a really great thing to do. And I think one of the things we really want to encourage is for more businesses. They also had the reception manager of the Holiday Inn down at Pembroke Park, and she was done to do it because she had a man who walked into the hotel, came up to the bar, came up to the reception, said, "I want a room. This is where I'm going to die," and that was her catalyst for wanting to do the training. So I think there are those kind of things out there, those training courses, but obviously we could do with, especially shorter courses, just even some refresher and some interesting. But I think that's certainly something that we can pursue, and we've got all the things like Shaping Portsmouth and everything. If we could get something into Shaping about mental health training, why that's important for even people like barbers and people in more the, could we say, masculine industries in the city, that's the place to go to really start to have the conversation. So I'm sure Steph at Shaping, if we can start having those conversations at that level as well, I think that'll be a really good place in. And I know through Steph and through Shaping, they're involved with Mardy and with the Mental Health Alliance, etc. So there's real ways we can get in and have those conversations with businesses and business people in the city.
Can I just ask, is like, before kind of, I guess, finishing off, is there anything like that we can set up as a kind of a little bit of a network between us, is all the good work that's being done locally? You're based in Portsmouth, we're Solent, so, transferring some of those good, and I think is to have push for a national policy, like you do have in the forces. So it is not a matter of lottery, but what is it that you do that you could share? And just asking if there's any YouTube, Facebook, because that Joe.co, I just looked at it and I didn't know it existed. So is there anything that we could share, not only to kind of learn ourselves, but to pass on, and maybe we could start something locally, be aware and pass and push, or get more people, more men involved, that we might want to start up something you do in your area that we could replicate, but it could come from an idea from training or a book or something that we can kind of expand our own personal knowledge, and comes with that is, not saying we haven't, but the kind of the confidence to really initiate those conversations and to empower other men, and to kind of do the same. So it's that expansive work all along. So I don't know if it's possible to set up some kind of network of information and sharing.
Yeah, absolutely. I think that's a very good idea, Stephen. And also, just one of the remit of this discussion that we set up is to discuss both the barriers and how to maybe overcome some of their barriers, maybe get people talking so that the stigma hopefully gets reduced, but also talk about the services that are available both within Portsmouth, and the invitation is really out to others from Southampton, across Hampshire. Anyone that has a passion in this area and would like to be involved could be involved in these discussions, which is sort of a one way of addressing what you're talking about. But certainly we can identify maybe almost like a directory of services and update that regularly and share that more widely, both within Portsmouth, but also surrounding areas.
I was also thinking anything on YouTube,
Yeah,
a book, something, anything that's kind of like, that's relevant and could be important and of interest.
Absolutely. And speaking of YouTube, the last of these edition that we've created is on YouTube. It's on our Talking Change page, and we'll share it with you so you can share it more widely on your social media platform, and we'll put this one there as well. So it's probably a good moment to bring our very productive and another really, really interesting discussion to an end. I just want to thank all my esteemed colleague who joined me today. It's been really, really helpful listening to you all. It's beyond the scope of this discussion to solve all these problems, but I do hope at least we've got into some of it a little bit, and let's just get talking. I think the more we talk about it, just today I've learned a lot of really good things from you guys. So if you be willing to share this in your social media, talk about it with friends, colleagues. This is about getting this as much out into community as possible. If we could only do that maybe hopefully there'll be more than that, but just one legacy that comes out of that and gets people talking, I think that in itself could make a big difference. So it's been a pleasure speaking to you all, and hope to have you there for the next one.
Thank you.
Okay, thanks a lot.
Thank you very much.
Okay, bye.
Bye.
Bye now.
Bye, guys.